Welcome to Nasdaq Trade Talks. I'm your host, Jill Malandrino, global markets reporter at Nasdaq. Joining me at the market site in Times Square, we have Merril. He's the founder of Adaptive Phage Therapeutics. On behalf of Next, powered by Schulman Rogers and Nasdaq, welcome to the market site studio. Tell us about Adaptive Phage Therapeutics.
Adaptive Phage Therapeutics is a clinical stage company that's addressing the worldwide crisis in antibiotic-resistant bacterial infections.
All right, now phage therapy, is that something that's new?
Phage therapy is actually older than antibiotics. Phage were discovered back at the turn of the last century, but they couldn't quite figure out how to make them work because the phage, which are viruses which kill bacteria, are very narrow in the bacteria they kill. And so sometimes they would match the strain that a patient would have, and sometimes they wouldn't. And then in 1941, penicillin was introduced, and it worked great up till recently when the antibiotics have started to run into problems with resistance.
So then how effective is it compared to antibiotics, and then will you run into the same thing too, where phage eventually becomes resistant to bacteria?
Well, that's an interesting question. So the bacteria are dynamic. They're reproducing every few minutes, and so they're always going to be able to respond to environmental pressures, whether they be antibiotics or whether they be phage. So what we're doing at Adaptive Phage Therapeutics is we've developed a broad spectrum library of these viruses, these phage, and we pick from that library and we're constantly adding new phage to the library. So it's actually a dynamic, adaptive therapeutic approach for an adaptive pathogen like bacteria.
Tell us about some of your use cases, because some of them are pretty amazing.
Well, our first patient that was treated with our phage bank, phage library, was Tom Patterson. He was on vacation in Egypt with his wife, and he contracted a very dangerous superbug called Abumani. He went into a coma and was in a coma for 4 months before his wife actually reached out to the Department of Defense and asked for support because she found out that there was a program at the DoD to use these viruses for biodefense purposes. But he was the first person they ever tried this approach on. They injected the phage into his IV line, and within 48 hours, he woke up out of a 4-month coma. It was an amazing success. And Adaptive Phage Therapeutics was able to acquire the worldwide exclusive commercial rights to that phage bank's product that was developed initially at the Department of Defense.
That's pretty amazing. Now, what qualifies as a superbug?
Superbugs are bacterial infections that are resistant to the antibiotics, so they are virtually impossible to treat.
All right, well, let's understand, to the lay audience, such as myself, what exactly is behind adaptive phage? What is that science like?
So it's really interesting. The phage themselves are isolated out of sewage. So if a patient's bacteria is grown on a petri dish, you can expose that petri dish to just sewage, and if you're, you might see little clear plaques appear in that petri dish. Those plaques are actually the phage killing the bacteria. So those can be isolated and then used as a therapy.
And phage bank, what is that?
So the phage bank is a large collection, broad spectrum collection of these phage, and you can pick on an individual basis the particular phage to treat an individual patient.
Is that like the library that you
That's the library.
That's the library you were explaining before. This sounds really unique. Do you have any competitors within this space, and what do you think the commercial value could potentially be?
So there are other companies developing, whether they be small molecules. Actually, the pharmaceutical industry has been struggling to develop new antibiotics to treat bacterial infections. There are other groups working on phage therapy, but we're a leading company developing this adaptive approach, and we believe that because bacteria adapt to environmental pressures, you need an adaptive approach to treat these types of infections.
Right, and the potential commercial value?
The potential is huge.
Right.
There's a multi-trillion-dollar cost associated with these types of infections, and the cost of an infection that can't be cured can run into the hundreds of thousands of dollars in a hospital.
All right, now the good thing is you were oversubscribed for funding, so how will that help you when you start to make this therapy available to the public?
Well, so we're now funded to go all the way through our FDA regulatory process, and so we're looking forward to making this therapy broadly available. It's fast therapy, and be extremely cost effective relative to the alternatives.
All right, the obvious question, can you take the company public?
We'll be looking at it. I'll be talking to you again soon, I hope.
All right, sounds good. Greg, thanks so much for joining us at MarketSite. And thank you for joining me on Trade Talks. I'm Jill Malandrino, global markets reporter at Nasdaq.